It's important to distinguish between sciatica and referred pain. And the reason for that is because it affects the treatment. So if you want an effective treatment approach, first of all, you need an accurate diagnosis. You need to find out what it is. But sciatica, unfortunately, is one of these terms that gets used quite broadly sometimes. So people often diagnose themselves on Google, or even they may get a diagnosis from a health professional who just hears pain down the back of the leg or pain in the back going down the buttock. Okay, that's sciatica. But unless you get it right, then you're not going to be able to treat that effectively. So I want to explain the differences in how it might feel differently and also how it would be treated differently. So if you have sciatica, or you think you do, then you might find this interesting. Sciatica, as you may or may not know, is pinching of the sciatic nerve. The sciatic nerve is a big, thick nerve that runs down the back of the leg, all the way from the lower back, the pelvis, down the buttock, back of the thigh, all the way down the calf and kind of into the foot. If any part of that nerve gets pinched, stretched, or inflamed, so we're talking about the actual nerve being affected here, the actual nerve being pinched, and that nerve comes actually from 5 nerves that join together here. So if any one of those, or the nerve itself, gets pinched, stretched, or inflamed, that's sciatica. Sciatic pain itself can be quite intense, and it's often quite sharp and shooting. If you lie on your back and lift your leg up, then you might get a shooting pain down the back of the leg. Now that's really indicative of sciatica. You might also get pins and needles, numbness, tingling, that kind of thing down the back of the leg as well, but not always. The alternative to that can often feel like sciatica and is sometimes misdiagnosed as sciatica, is what we call referred pain. So in this case, the pain is not to do with a specific nerve getting trapped or pinched. It's just something else, some other structure like a joint, ligaments, muscles around that area that is sore, inflamed, getting loaded and stressed more than it's designed for, more than it's happy for. And because of the way the nerve fibers in the body are kind of all linked up, even though the pain might be coming from, say, this joint, so it's not the sciatic nerve this time, it's the sacroiliac joint, or the muscles, or the glutes, the muscles around here, or some of the joints in the lower back, the brain can't distinguish exactly where that pain's coming from. So you might have pain in this area, but you'll also feel it kind of spreading down that area. And that's why it's often confused and misdiagnosed as sciatica. The pain's often different, so it's often not quite as intense. It's more of like a deep, aching kind of feel, harder to pinpoint exactly where it is. You won't necessarily get the same positive straight leg raise. So when you lift your leg, you may feel a little bit of discomfort in the back, but it's not going to shoot down the leg, and you probably won't get any of those numbness, pins and needles type sensation either. Again, getting an accurate diagnosis is of course what we train so long for, so it's not always this simple, but I'm giving you the general idea. So because the pain's coming from a different place, you need to treat it accordingly. So if we're doing hands-on treatment, for example, you need to make sure you're treating the right bit. So rather than just assuming it's sciatica and adjusting the bit around the nerve, we also want to be addressing, if it's not strictly sciatica, we want to be addressing the muscles around here, the other joints, the joints in the pelvis. We might use hands-on treatment to do that, like adjustments, manual therapy, or we might use acupuncture to help release the tension and soreness in the muscle there. And of course, any exercises that we give people are going to be a bit different depending on what the cause is as well. So I just want to give you a general overview there, just to explain that there is a difference between sciatica and referred pain. And the take-home message really is that it's really important to get an accurate diagnosis, because that will affect how effective the treatment that you get is. If you've got any questions about that, about sciatica, or about anything else in terms of back pain, leg pain, nerve pain, please pop a comment in the messages or send us a message. I'll see you soon. Take care.